was just thinking, oh, this is going to go on Chris and Sabrina's show and just give him a little update. And now Ray Boston had to go and mess up the bed for you. And now you got to.
So, Lieutenant Governor, who in the federal government told you got to hire Ray and clean up the mess at Gora?
Oh, man.
Good morning, everybody.
Good morning.
Good morning.
Lieutenant
Sorry
Governor.
about that. Good morning first. So, who? Hodzi.
It's Uncle Sam, right? It's Uncle
Yeah.
Sam?
Who in the federal government said he has to be hired?
I'm not gonna say I don't know. All I tell you that there were a lot of concerns and in transition, and even after he came into office, the feds at HUD have been happy with the new direction that Gura has been in. That being said, unfortunately, this is just not a good time for pay increments for any of the any cabinet member or agency head. And so, I just say, I appreciate the work that he and the deputy are doing, but unfortunately, this is a different time right now. We're in a pandemic, and with so many thousands of people that are out of work or having the challenges, it's just not an appropriate time for that.
Right. So is that I don't know what the hell he's talking about or what? Because
sounds like
he said he's got proof that the feds said that he needs to be hired, that he should be hired to clean up all the whatever's going on at Gura. So, I mean,
well, I think we established that a lot of stuff, there were a lot of issues there, and he played an important role in getting it cleaned up. And I'll also say that obviously there's also been a long-standing lawsuit that's been going on over there. And so they're part of what I think Ray's talking about was his lawsuit has to do with the wrongful termination. And one of the ways to mediate would be to reinstate him to his old position. Of course, he was appointed to a new position as the agency head.
Right.
So I would, based on what I'm hearing, I would think that would be the case. That would be the issue, and it coming from the Justice Department probably.
Right. That's a little different than the way he explained it, where he said, oh, yeah, the Fed said, no, you got to hire this guy. I mean.
Well,
okay.
Feds can recommend, right? But
right.
the governor appoints the board will select somebody, and then, we just want to make sure that they do the right thing and do a good job.
Interesting take on it, LT. And good morning.
That's my take.
Yeah, hey, well, it's a good take.
we'll take it.
Yeah. We'll take that take. Okay. Let's just jump right into the budget. Governor's substitute bill. Thou shalt not pass.
Before we do that, I just want to, it's my first time to talk to you in about a week. And since we last talked, we lost many people, including the child the other day. And so, I've been thinking about that nonstop. I'm sure you guys have been too. Yeah. And notwithstanding the fact that there may be other, health conditions going on with people. But again, like I said last week, this certainly wasn't planned by their family. And I just want to express my condolences, and in particular, really mourn the loss of this child.
What can you tell us, Lieutenant Governor? Because I've asked a lot of people about this, and a lot of them don't know anything. We tried to get a hold of the Naval Hospital. We're not sure if this child was a dependent of a military service member, or if it was one of those situations where it was so dire that they had to go to the closest hospital. So we don't really know anything, it's kind of alarming.
Yeah, I don't know any more details other than I did hear that the child was not military dependent. I just heard that this morning, but I'll probably get a confirmation from what the Navy hospital is going to report through the surgeon cell.
Right.
So get all the details, but it's a big loss, I would say, for a child.
So, wait, you said he was not a military dependent, so he may have been transported to Naval Hospital by Guam Fire, right?
That's all I know, is that he wasn't dependent. I'm not sure, as you know, people who are not dependents or not entitled to healthcare at Navy hospitals sometimes get their presented themselves either to the gate or that's the closest. I don't know all the details yet. I'm guessing that might have happened, but I'll wait to hear the details and see what Navy hospital is disclosing to public health and to our surgeon cell.
Right. Yeah. And we did want to touch on, obviously, just the deaths. It's out of control. We had Dr. Uggan on yesterday from the Guam Memorial Hospital, and I thought she did a good job of explaining how this virus has, I don't know if evolved's the right word, but how it was thought in the beginning to attack the lungs, and now she's saying that they find that as it moves through the vascular system, it attacks other parts of the body with
I mean,
patients with
some,
comorbidities.
just even for me, right? Some insight for me before I tested positive. I actually had, going through my regular blood work, and I did a stress test. First time I did a stress test, I did pretty good. And I was just reading articles about long-lasting effects on people post COVID, and already wondering whether or not when I go to see my doctor, do I need to get I probably should get another stress test to compare pre and post, because we're not sure what the lasting health effects are for those of us that have recovered. I've been reading the same articles and, seeing how this thing has been evolving, and even wondering how that's going to affect myself long term, if any. Hopefully not. But it is a big mystery for us.
Right. Can we now get into the budget, LT? As you saw,
Yeah.
you saw that the substitute bill shut down last night in a pretty fiery session. Were you watching, and what was your take on that?
I didn't watch it yet. I'll go on YouTube and take a look. I guess my take on it is we all have our responsibilities, and 8 of the senators that are in session, based on their authority and based on their judgment, decided to vote against the bill. And I guess this afternoon, Senator San Augustine will make a motion to override, and we'll take a look and see what happens with the override. Assuming that let's say that the override does occur and that the veto is set aside, then we just need to shift the focus on trying to figure out a good pathway to maintain the stability at public health, despite the $14 million pay cut or $14 million agency cut that they have, and try and figure out what avenues we have to maintain the levels at public health, knowing that public health is in need of a lot of different things to respond.
Right.
But I think that's going to be the task and the primary responsibility that we will have once, if and when a veto is overridden.
Is it really as simple as some of the senators say? Well, we've got this CARES Act funds, geared towards COVID-19. Could we give public health $14 million or whatever that you said they need to respond to this pandemic? Could that be done with the federal funds, and then the local funds be used to shore up whatever non-COVID? Because it kind of seems in my mind like, why aren't we doing that? And you guys were called out for it last night. And
we just can't. We just have to follow the rules and make sure that we don't supplant. The big thing with federal funds is you can't supplant, and which means in that simple way, shifting people that are obligated to work on things on the general fund and move them to Fed funds, unless they are departing from their job and taking up a new responsibility that is funded by the federal government. But it is, I guess we definitely get into the intricacies. I know that public health is looking at that, just trying to make sure that they channel the resources to respond to the pandemic, and then figure out what kind of services may be left behind or set aside that are not COVID related or are not directly responsible for the patient health side. But I think that's a lot of work getting into the details. And, definitely I'll be looking at that very closely as well.
What was the point in this Senator Therese Terlahi letter on, reminding her of her fiduciary and ethical and moral responsibility? Because, that letter, it set her off last night.
I know that wasn't you.
Well,
I
guess it's a clash between the oversight chair and her responsibilities and the expectations that people have for her to provide over the healthcare side, and the conflict with the governor and the differing opinions. I read the letter briefly this morning, and I there's a buzz about it. I've heard some folks asking
Just a
about
little
it.
buzz.
It's a
you know.
tiny,
I
like
guess
a
I have
little.
to use my Google here and or go back into Facebook and rewind your
I'll
show
send you
so I
the
can
clip.
listen to
Yeah, we
more.
can send it over.
Yeah, that just I just got
Yeah,
off the
send me the link.
news and
Yeah.
I heard her, upset because I leave my TV on session and I didn't know what was going on, and then I got a copy of the letter and I was
Right.
like,
Yeah.
oh,
And basically, it was the letter, and as you read it, I'm sure you know, called her out and said, "Hey, as the chair, you're supposed to do what you can to save lives." And then she kind of clapped back and said, "Hey, well, hold up just a minute, because you guys got all this federal money. We passed 10 million for Guam Memorial Hospital. They never saw it. So I thought it was,
yeah. I mean, and there was also a part about some politicians choosing to grandstand.
right. Yeah. Was that? I mean, and that's on the governor's side of the house. But I know you guys are a team. But that kind of the tone was pretty. And the tone that we saw with some of these budget graphics that come out, some might say condescending a little bit. What'd you make of that, LT?
Well, I mean, I guess this is the part of the discourse. Some people like it, some people love it, some people hate it. um, I think that they have opinions. They have certainly, the governor for sure. She's motivated by her real belief that the budget shortchanged public health and puts us in a bind. And although there is a significant or a 15% transfer authority, which is in good times is a typical amount. I think that she's responding to that pressure of that responsibility, and she sees that as her number one right now. Number one responsibility is to address public health of the people of Guam, and she does not believe, we do not believe that the budget is in line with that. That being said, we're going to have to deal with whatever the realities that come. And I know that the governor for sure is not in favor of an override of the veto. I support her in that. But no matter what, on October 1st, we are running the government, and we will make sure that we do everything we can to empower everybody in the front line to try and respond the best that they can, and to make up for things that they don't respond the best. It's always constantly a movement to try and figure out how best to respond and how best to keep people safe. We don't always get it on the first try, but that's our motivation, is to try and respond in that way.
So we just got the memo that there is going to be a emergency session at 2:00 this afternoon. Say this override attempt fails. Do you know what's the next step in the process?
Then the next step would be for another budget bill and another budget session. And gosh. I would say, since the governor's substitute budget focused in on the $7 million and the allocations, I would think that the debate and the discourse should focus in on that to try and catch up on some time. But that would basically it would be almost like Groundhog Day. We'd be kind of like starting from scratch, but I would say like maybe 90% of all of the stuff is already done. They just need to focus in on the public health side of it and how they would agree to increase the revenue projection. I guess that's the other discourse, is whether or not, because we are in this situation, some senators are not very comfortable in increasing the revenue projection, whereas the administration, based on the tax collection that we've been doing and the aggressive revenue collection, especially for back taxes, we believe otherwise. But the purse string and the responsibility to determine the budget rests with the legislature and the administration. We have to execute and implement whatever comes our way. And this is a time to try and influence and to be clear with the impact. But other than that, we'd be basically having to start a new budget bill.
Wow. Any comment on the sudden retirement of Public Health Medical Director Dr. Jenna McGlutnia?
I just want to thank her. She actually is in my neighborhood, sort of in my neighborhood. She's on the way other side of my neighborhood in Telefofo, and I know her husband Martin very well. I just want to thank her for her service. I was surprised; I did not know about it until Monday when the governor shared the letter with us. And I didn't expect it because I was watching briefly the confirmation hearing for Arts and Augustine on Thursday night, I think it was, and
Right.
she was well engaged,
Yeah.
as she always is.
We had her on
But,
Wednesday.
huh?
We had her on Wednesday, and yeah, we did a whole interview, and not a word about retirement.
Yeah.
Like, what?
Well, people in these positions, and if you read some articles throughout the states, a lot of senior public health
Yeah.
officials are leaving their posts. Part of it is they don't want to deal with the politics, or, it's just a lot. I mean, these people have been working 7 days a week, and at a certain point, you think to yourself, is this how I want to spend the quality of my life? And, I respect the decision that she made to go ahead and do the retirement, but I do want to thank her for her service.
Right. I want to ask LT because we just sent the FOIA, but and I know Ray's not Ray's was through the board, but are there any more unclassified GovGuam employees at the cabinet level or whatever who have received any pay adjustments or pay corrections or anything that
Or approved.
that you signed off on or the Gov that you know of?
No, not to my knowledge, and certainly nothing that I've participated in, but I would expect that there shouldn't be. Now, that being said, all the autonomous agencies have their own pay scales and their boards operated. They got decentralized many years ago. It used to be a unified pay plan or a unified pay policy, but not to my knowledge. And like I said, and if there are other performance evaluations for any of the other autonomous agencies that are up, I just advise the boards and their agency heads, yes, do your performance evaluation, but certainly this is not a time, and there shouldn't be any pay adjustment during this pandemic and until we get this government and the revenue stabilized.
We talk about pay raises, and it kind of came up, and it has been a recurring theme: pay cuts, right, for at the cabinet level. And I know the governor has vehemently said that's not going to happen. Are you guys on the same page with that?
With no cut reductions in salaries?
Right.
Well, I think we try and do everything we can not to get to that point, for sure. But yeah, of course, I'm on the same page with her.
Right. Okay. Bree?
No,
Are we forgetting to ask you anything else?
anything
I
new
will
with the
see you
homeless
again.
shelters?
Right. Yeah.
A new homeless shelter? Other than just global?
I wish. So we have some prospects in Tumuning, but the prices are not coming in the right way, not fair prices. I had a meeting about that actually on Friday, just touching base, getting briefed by GSA and Civil Defense on the efforts, but we don't have a fair price or a sustainable strategy yet in Tumuning. But there's pressure on, and there's a waiting list of 23 at Global. And based on Catholic Social Service last report on their outreach, there are more people willing now to get shelter than were last month. So there's two of them. That's the one in Tumuning, and the second one has to do with the 11 patients at GMH and GRMC that are taking up acute beds that should be discharged, but they're not because they don't have any place to be discharged to. A lot of these are seniors. So Dr. Margaret Hattori Uchima from UOG, who's on the council, has been the lead from our council, but working with the Surgeon Cell and Public Health to also get a facility to transfer those that are in the hospitals that don't require that level of care, that can step down, but don't have any place to step down to. So most of the 11 people would consider as part of the homeless population because there isn't a place to discharge you. Some of them, they might have relatives, they live on a second story of an apartment building that doesn't have an elevator, and they might be an amputee. There's different things that the social workers and the health folks are looking at, but we're working right now to try and on an interim basis, move them into a public health facility on Woodstock Road that has been used before as a dementia center, and we would only have that building, I would say for a few months while we find a permanent solution. I mean, optimally, the goal, of course, is always to normalize services, and then we would want to return the services that were once there. But that's the second group. So I have two groups I'm monitoring right now on the homeless / healthcare front, and those are the two.
Man, LT, before we let you go, we talked with Superintendent Fernandez last week, and I know that some of the board members name drop you, talking about discussions to bring more accessibility for online services and whatnot for the kids. Can you just give us a status update on where you guys are at and working with GDOE?
Sure. So for the $12.5 million of education assistance funding for all the school students, we're working with DOE. We have a proposal we submitted to DOE to U.S. Department of Education, where we're allotting nearly $9 million, about $8.9 million. We would send over to DOE in a sub-grant that will be for all students it'll be subsidized access for the homes for students attending public, private, or charter schools. And then the rest of it has to do with, we have a movement to invest more or install more online Wi-Fi resources in the libraries, in the community resource centers. And then we're also working with the Mayor's Council to figure out how to, and for their assessment, to also make the same investments in the community centers. All of that will join about 23 school campuses that DOE has identified for the same. And it's basically to try and step up Wi-Fi access or add on additional facilities for students and parents to come so that they could avail themselves of the connectivity to try and support the work. The other big portion is with PBS, and we have plans with DOE to expand the PBS University and to increase the production capacity of it, make that available to all students. And then also at Department of Youth Affairs, the DOE runs a school up there too, and in this kind of environment, it's also going to try and facilitate the distance learning on that side. So all of it really it's working cooperation and collaboratively with DOE on trying to address the access at the home front, but also access to facilities that can support the distance learning.
Thank you, LT.
All right. Well,
Thank
thanks.
you.
Have a good day.
Yeah, we'll
All
see you
right,
next
take care.
Tuesday. Go chew
All
out.
right,
Go
good
chew out, Ray.
to, just want to say good morning to Mrs. Gutierrez and to Mark Mignola
Right.
from the board.
Right.
Thank
Yeah,
you
they're
from-
standing by there yet. There you go. They're
right.
waving.
Good morning, Lieutenant Governor.
Oh, there you go.
Good morning. Thank you.
Take care.
Okay. And he's out. Right on. We're going to take Mrs. G, a very short, I'm only going to play 4 commercials. And then we're coming right back to you guys. We have the chair and the vice chair of the Board of Education next. On the link, it's The Breeze 93.9. Good morning, Guam.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience.